Good afternoon. Good afternoon to the esteemed panelists here. Firstly, I want to thank Caho for giving me an opportunity to address this August gathering. And I think my session is the shortest among all the sessions that you've had, so I'll try and keep it short and crisp. Before I start, just for the sake of full disclosure, I am not a doctor. This is, after all, Cahocon. But I do dabble a lot with data, and hence the topic that was given to me to talk to you about is healthcare analytics. Now, healthcare analytics, and as the speaker before me alluded to, so many different applications. It's an ocean by itself, and we only have, 10, 15 minutes, so there's only so much we can talk about. Now, for those of you who are new to healthcare analytics, some of the applications that I have seen in healthcare analytics, you have detecting fraud risk, especially when it comes down to insurance. Just a couple of months back, I was advising one of the biggest health insurance companies in the country. They have close to around 70-80% of the market share, and there's a bunch of different things that they want to do, especially on the reimbursements, whether they can detect fraud or not. Then you have predicting disease outcome, especially more so in the pandemic. Then you have predicting treatment plans. How is that going to augur well for the patient? Forecasting patient loads. And again, going back to the pandemic, one of the big panic buttons that was hit was, hey, the healthcare infrastructure is going to get overloaded, so let's lock down and unlock down and all these different things. Fundamentally, because we're trying to forecast the patient loads and whether we have enough capacity to go ahead and support that. Then you have predicting the benefits of drugs, ensuring data security. But what I want to talk to you about in this 10-15 minutes is fundamentally talking about inventory optimization in the inpatient pharmacies and pharmacies that are not within the hospital, in terms of how they can go ahead and make it more efficient, make it more effective. I don't know how many of you know, pharmacies contribute close to around 20 to 25% of a hospital's revenue. But having said that, it is also one of the most neglected ones, simply because the doctor has better things to do, right? And it falls on the shoulders of the administrators. So what I'm trying to tell you is, there are a lot of low-hanging fruits when it comes down to trying to optimize your pharmacies, trying to optimize your inventory, and all that is only going to benefit the hospital. So, talking a little bit on the inventory optimization in stores. So, typically, what are the major categories of inventory that you will find within hospitals? Three major categories. One is what we call as consignment inventory. Now, consignment inventory means all these high-value inventory that we have, which we don't really own, meaning when I say we, the hospital does not own that inventory. It is the vendor, the supplier, who's responsible for that inventory. So you have these pacemakers, you have these catheters and things of that nature, which are very expensive, but the hospital doesn't care, because even if they have a procedure at 3 a.m. in the morning, it is the responsibility of the supplier to ensure that that material is available. Now, the second category, which I'll be spending a lot of time on, is the non-consignment inventory, which are basically most of the items that you would find in the pharmacies. The difference between consignment and non-consignment is inventory that you don't own. However, you have created some space within your hospital so that they can store that inventory. Non-consignment inventory is inventory that changes ownership the second you receive it within your hospital. So, meaning if you have any credit line with your supplier, that time starts to tick the second you take possession of it. And of course, you also have consumables, meaning your linens and the maintenance and repair and operating supplies that you would need to go ahead and manage your infrastructure within the hospital. So as I said earlier, pharmacies contribute 20 to 25% of a hospital's revenue, so that is a pretty significant chunk to put our focus into. And more than 60% of what they spend on inventory is fundamentally spent on non-consignment inventory. So what are some of the issues that hospitals face when dealing with this non-consignment inventory, which is basically your drugs, your medicines, and things that you would find in the pharmacy? There are very many issues. I tried to just list a few out here. One is you have very poor visibility of the performance of the store. Because a lot of the software that is available, all your healthcare information systems, your your HIS and your EHRS and things of that nature, they're all built on monolithic ones, so it's very difficult to go ahead and get the information that you need in a timely manner so that you can drive your decisions based on that. And then you have unsystematic ordering of items. Everything is ad hoc. Hey, we don't have stock of this item. Okay, how many should we order? Go ahead and place 100 units of it. Why should we place 100 units? Because I think we would need 100 units. Right? There is no real scientific evidence to go ahead and support that. It is done in a very ad hoc manner. You have your increased stockouts. You know, we always say that when it comes down to inventory, I always seem to carry a lot of items that I don't need, and I'm always running after items that are in demand, right? So this is like a bimodal distribution of inventory, as we would like to say. Then I have large quantities of wrong inventory, and as I said, the software are just very difficult or not so user-friendly for you to run analysis and reports, and it takes sometimes you'll have a department that's dedicated to pulling data from the software, creating these reports, and then presenting that to management so that they can make some sense out of that. But having described all these issues, I would also want to add that whatever may be your problem, right, there is always a solution that is available on the cloud. So there are a lot of software that are available that hospitals can really take advantage of and try and improve their pharmacy performance, try and increase their cash flow. So when you do try and invest in some of these software, what is it that you can aim to get out of it? So one is you can optimize your inventory, and these days inventory is being optimized using advanced machine learning and AI algorithms. You can go ahead and the idea is to reduce your inventory investment by 25%. And I have observed both in India and Europe that, and I'll give you an example. Like if I have a 300-bed hospital in India, the value of inventory that I'm carrying across all my stores within the hospital can be anywhere upwards of 5 CR, 6 CR. So you have 5 crores of inventory, 6 crores of inventory, and I'm talking about this in your non-consignment inventory. That means inventory that the hospital owns, and the hospital needs to try and push that out as quickly as possible so that this inventory, if I dabble a little bit into finance, inventory in your balance sheets, they show up as assets. But they are only a notional asset, because unless you move them and convert them into actual money, it is just a notional asset on the books, and that is of no use to anyone. So I want to try and reduce my inventory investment. So if I have inventory of over 5 crores, and if I'm able to get a 25% reduction, that is pretty significant. And what can I do with that reduction? Obviously, that is going to have a lot of positive outcomes for the hospital. And then from a pharmacy perspective, what are my indent fill rates? So typically, you would go ahead and get requirements from the doctor who will diagnose the patient, for example, give the prescription to the nurse. The nurse is then going to take the prescription to the inpatient pharmacy and say, hey, I need all these drugs so that I can go back and administer them to the patient. And you wouldn't believe some of the turnaround times from the time the doctor gives the prescription to the nurse to the time the nurse is able to administer the medicines back to the patient. It can be as long as 2 hours, 3 hours, sometimes even greater than that. So how do we go about having a shorter turnaround time to go ahead and administer these drugs to the patient? And people really hate waiting in hospitals. I'm sure you're aware of that. And increase your inventory turns by 50%. What do I mean by inventory turns? So how many times are you able to turn your inventory over So if you look at, I think the previous speaker alluded to Amazon. Amazon, in spite of doing 1 billion transactions a day, they are able to turn their inventory over 12 times a year, which means every month, all their inventory gets turned and they're getting new stock. And that is great outcome for the organization. And then lastly, for something like ad hoc ordering of inventory, so that is heavily relied on the store managers or the pharmacy heads to go ahead and do that. How are they going to do that? Right? Can we go ahead and make that more system-driven than people-driven? So something that can be looked at. And this is at the store level. Now, what about at the hospital level? What are the advantages that you can have to go ahead and run it at the hospital level? Now, of course, in a 300, 500 bed hospital, they have so many different stores. You'll have like a surgical store, a lab store, a nephrology store, a radiology store. So we have all these different stores. So do I have end-to-end visibility across all these stores? So that is something that they should try and get. Also, what happens is tracking supplier performance at the item level. Now, if you look at majority of the HIS systems, what happens is when I set up all the drugs that I want to go ahead and have in my pharmacy, I go ahead and have static reorder points, reorder quantities, and say, you know what, this drug is going to take about 5 days to be delivered by this particular supplier. Now, over time, that is not tracked. So what happens if the supplier's performance has deteriorated or if the supplier's performance has improved? Are you able to keep track of that? Current systems, unfortunately, are not very user-friendly to go ahead and have that done. And I want to align the ordering with my consumption pattern. A lot of the time, it's my left hand places the order, my right hand is issuing against indents that I'm getting, and the left hand does not know what the right hand is doing. Right? There are all these blind spots. So how can I go ahead and align my ordering with my consumption? And lastly, how do I go about increasing the responsiveness of especially critical items across pharmacies within the hospital so that I can try and give a better customer service level to my patients? So the things that you should care about, we call this the 3 Ps in hospitals. For you to have better patient care, take care of your products, and that's what I want to emphasize on, and thereby you're going to take care of your profits as well. So with this, I would like to end my presentation. Thank you very much.